You will be performing an eyes, ears, nose, and throat system assessment for Mr. Serby. He is a 63-year-old business owner who lives with his wife. You will be performing an eyes, ears, nose, and throat system assessment for Mr. Hayes. He is a divorced 38-year-old male who had a heart attack 6 months ago. You will be performing an eyes, ears, nose, and throat system assessment for Mr. Perez. He is a 28-year-old male who works as a marketing executive. He lives with his wife and 2 children. During palpation of the lymph nodes of the head and neck, it was noted that the jugulo-digastric and superficial cervical lymph nodes were swollen and tender to touch bilaterally. Click on the Complete button once you are ready to move to the next step of the assessment. For the first part of the assessment, perform an inspection of the external ocular structures, particularly noticing the eyebrows, eyelids, eyelashes, and the alignment of the eyeballs. To expose the conjunctiva and better inspect the sclera, place your thumbs below the patient's eyes on their cheekbones. Remember to make note of any abnormal findings. Next, you will perform the diagnosis position test to evaluate the patient for nystagmus. Have the patient track your finger's position through. Remember to note any abnormalities. Now, you will assess the patient's peripheral vision on their left side. Your patient will cover their right eye with an opaque card. You will need to close your left eye for the purpose of completing this assessment. Ask your patient to say now when your finger comes into the patient's view. Remember to note any abnormal findings. Now you will assess the patient's peripheral vision on their right side. Your patient will cover their left eye with an opaque card. You will need to close your right eye for the purpose of completing this assessment. Ask your patient to say now when your finger comes into your patient's view. Remember to note any abnormal findings. Now you will inspect the ocular fundus using your ophthalmoscope located in your tool belt. Remember to note any abnormal findings. Now you will examine the external structures of the ear. Next, you will need to pick up your otoscope located in your tool belt to view the external auditory canal. Remember to note any abnormal findings. For the first part of the assessment of the nose, perform an inspection of the external structures. Remember to make note of any abnormal findings. The next step requires you to check for nostril patency. Instruct your patient to take a breath through the nose while you depress one nostril. Now, you will palpate the frontal and maxillary sinuses. Ask your patient if the area is tender when you palpate. Remember to make note of any abnormal findings. This assessment requires you to inspect your patient's mouth. Ask your patient to pull down his lower lip to inspect the mucosa teeth and gums. In this final assessment, you will need to inspect your patient's throat, using your pen light located on your tool belt. You will be asked to document any abnormal findings once the assessment is complete. This concludes the assessment of the eyes, ear, nose, and throat.